I am a kind of a happy, sort of go lucky person. I like being positive. I try to just get on with things in the happiest sort of way. And hopefully that helps your overall health, weirdly. I do
Sure.
try to be upbeat as best I can,
Yeah.
but definitely if they have a temperature, I'm like, oh my God, I have to call Hillary.
The Dr. Hillary Show, brought to you by HealthSpan, bringing you quality vitamins and supplements since 1996.
Hi, I'm Dr. Hillary Jones. Welcome to episode 5 of the Dr. Hillary Show. Coming up, a woman who's been on our screens for over 2 decades. From her early days on BBC Northern Ireland to becoming a household name across the UK, I'll be chatting to Christine Lampard. Plus, an aspect of our health that's often overlooked but is really important. That's our eyes. Many of us take our eye health for granted until something goes wrong. But poor eye health can lead to a range of issues, from simple discomfort to serious conditions like glaucoma, cataracts, and age-related macular degeneration. I'm joined by Denise Voon from the College of Optometrists and Ros Musa, an eye health expert. But first, some of the medical stories that have caught my eye this week. A recent report has just confirmed what Professor Steve Ryder was telling us in one of our previous episodes about the amount we drink, alcohol I'm talking about. We've just heard that in 2019, recent data, that Europeans, and that included us at the time, drink on average per adult the equivalent of 9.2 litres of pure alcohol every year. That's two massive buckets of pure alcohol, the equivalent of 102 bottles of wine, or several bottles of spirits, 31 bottles of spirits. So I would say that we're pretty good at knowing how to harm ourselves. And this was reinforced by other stats I learned about obesity. So we know that 2/3 of the adult population of the UK are either overweight or obese. We know that in reception classes in children, 10% are already obese and another 12% are overweight. And by the time they get to year 6, when they're 10 or 11, that's increased again. Piling up problems for the future in terms of diabetes, heart disease, bone and joint problems, mood issues, quality of life issues, such as not being able to move, not being able to sleep. So we definitely need to do more about this. And I'm very pleased that in the King's speech we heard that there are moves to restrict the advertising of junk foods and ultra-processed foods, certainly before the watershed, I would say forever, at every time, but at least that's a start. And restricting the locations where these things are sold, particularly sugar-sweetened beverages, which have very much increased in the last 30 years in parallel where the obesity is in the globe. So by making small changes, we can affect people's health. The sugar tax levy introduced not so long ago certainly has helped, but we're still consuming far too much sugar, far too much alcohol. Our capacity to harm ourselves as human beings is extraordinary. Another story that I thought was interesting was a report that had been commissioned by the Civil Aviation Authority about allergies on aeroplanes. So we've all been on holiday recently, or we're looking forward to going on holiday and flying off to some nice sunny clime. And often we'll be told, please don't eat any peanuts. We're not serving peanuts. There might be a passenger on board with a severe peanut allergy. And what the report found was quite interesting. It found that actually we're probably over the top. I know that this is important for people with severe allergies, but the evidence shows that there is hardly any risk in the allergen being airborne within the plane itself. So unless you're sitting next to a passenger with an allergy, it's probably okay for other people to consume nuts if they want to. What is important is that anyone with an allergy wipes down the hard surfaces, such as the entertainment screen, such as the tray, such as the armrest, because it's the sticky allergens on hard surfaces more than any airborne allergen that is the risk to them. And of course, they should always carry their 2 adrenaline auto-injectors. and there should be buffer zones in the aircraft, so that, as I say, if you're sitting next to someone, you are extra careful and vigilant. And the policies on aircraft should be consistent and clear. And I think if we adopted those kind of policies, we're better off. The risk in the air on a plane is actually less than it is on the ground. That was the important finding. So those are the things that caught my eye. Still to come?
In the end, after about 6 months of hardcore training in the winter, in the rain and the cold and the ice, I got the wetsuit on, and it was 22, 24 miles of the English Channel. I couldn't even see the boat in front of me because of the swell. It was just petrifying.
I'll be chatting to Christine Lampard.
The Dr. Hilary Show, brought to you by HealthSpan, bringing you quality vitamins and supplements since 1996.
Hi, I'm Emma. I'm the producer of the Dr. Hilary Show. I've got another question.
All right.
So we've talked about vitamins and supplements and how they can help from things, your brain health, gut health, and, everything else, and like your eyes. But how do we know if we're buying the right products for us?
I mean, people are fascinated by the value of vitamins and supplements, and everyone's different, everyone's individual. So it's important that you do some research and go to a company that's reputable and well established. I've been using HealthSpan. They were established in 1996. They use a panel of their own experts to create their supplements. And they're using sustainable products which are based on science. And I think it's about trust. So going to a company that you can really trust and know what's in those supplements, know what the ingredients are.
So the ingredients in supplements are important then?
Really important. And it's important to ask, why would you need those supplements? What they are, what dosage, what's the best timing, where they come from, are they sustainable? I think by asking all those questions, you're going to get to taking the right one for you.
And how can we find the right ones? Where's the best place to go?
Well, I think research is important, and go to a company that's well established and reputable, that's been there for a while. And I think, for a start, HealthSpan's website would be a good area to begin with.
Brill. Thanks, Dr. Hilary.
Pleasure. This week, I want to focus on something we often take for granted, our eye health. Good vision is essential for almost everything we do, yet many of us neglect regular eye care until problems arise. From screen time to aging, many factors can affect our eyes, leading to issues that can seriously impact our quality of life. To help us understand why taking care of eyes is so important, I'm joined by Denise Voon from the College of Optometrists and Ross Musa, an eye health expert. So let me start with you, Denise. You're sitting in the studio. Just remind us what an optometrist is. People know what an ophthalmologist is, I think, and an optician. What's an optometrist?
Well, first of all, thank you very much for having me on. It's
Pleasure.
a real pleasure to be here. So an optometrist is an eye care professional, and they generally work in a range of settings, but most of your viewers and listeners will probably be most familiar with them in their community opticians practice where they do an eye test. So during the eye test, what they're doing is they're testing your sight. They're having a look to see what your prescription is and how well you can see. They're also checking your eye health, probably most importantly. And then from that, they'll be able to treat and manage or refer as needed.
Perfect. And we also have with us today Ross Musa. Would you like to introduce yourself on a Zoom over there? Because I know you couldn't get into London easily today. And tell us what you do.
Yes, hi. Thank you very much for having me on via Zoom, as I couldn't get flying down to London. My name is Ross Musa. I'm actually a contact lens optician. So I really concentrate on the front surface of the eye, where contact lenses lay, etc. And I generally have a specialist interest in dry eye disease. So that's where the tear fluid is on the front surface of the eye. And I also work for the Body Doctor, and I'm their learning and development manager. So what that really means is I look at all of the education behind why clinicians do certain things and why patients do, manage conditions.
Excellent. Well, we know how important the eye is to our everyday life, but as I've said in my introduction, people often neglect their eye health. How important are regular eye checks?
It's so important. And exactly like you said, the number of people I've had said to me, oh, I don't need an eye test, I can see perfectly well. But that actually isn't necessarily true. So during an eye test, and when you do go and have your vision checked, there's a couple of things people don't realise. And firstly, your vision can actually change very slowly. So you might think you can see perfectly well, but actually it has changed quite a bit. And not being able to see as well as you can impact you in a number of ways. I mean, firstly, it just might not be comfortable. You might not be able to see your computer screen as well. You might not be able to read comfortably, or it could impact driving, sort of how well you can see and whether you're legal for driving. But I guess what can be more worrying for people is there are certain eye diseases, such as glaucoma, which you've mentioned before, which actually the patient won't necessarily notice any problems until quite late stages of the disease. And then once you've lost your sight from glaucoma, there isn't anything we can do to get that sight back. So what we want to do, or what we want your viewers and listeners to do, is make sure that they go and have their eyes checked regularly, so that if there are any problems, we can sort of treat it early and start that management process.
Perfect. So what sort of problems are you seeing, Ros, in your clinics?
So it's a very good point that you make, Denise. It's about the fact that it's those silent diseases, as we sort of like tend to call them, the signs before symptoms. A lot of times what I tend to see in the clinic, being a front of eye person more than back of the eye a clinician, I tend to see quite a lot of issues with the tear fluid on the front surface of the eye. So it's like dry eye disease starting quite early. And you kind of, it's that frustration that everybody just kind of manages and deals with and kind of thinks, well, that's normal because I'm on the computer so much, so therefore my eyes are going to feel a bit sore, they are going to feel a bit red. But the reality is that if we step in there, we can actually keep that functionality going really well, in the same way as we do with macular degeneration. We're talking about the back of the eye and glaucoma. It's those signs before symptoms. If we can get in there, then we can actually really affect the trajectory of the disease. We can really kind of like manage it really well at that point.
I think it's the case, isn't it, that dry eye syndrome is probably the commonest problem that we see affecting the population generally. I've certainly suffered from it in the past, and I say I used to because now I've availed myself of treatments that have been effective. But so many people, Denise, don't they, have, dry, irritable, red eyes with flaky lids and soreness, but people don't have to put up with that.
No, absolutely. And this is something people say to me, oh, I just assumed I had to put up with it. No, but you absolutely don't. You can come and see, the most important thing I think would be to come and see your optometrist, because they'll be able to look at the reasons why you're getting the dry eye disease. I mean, as you know, there are different causes and therefore different treatments that you can do. But just generally, the sorts of things that you can do to help, which I'm sure you've done yourself, are artificial tears. So you can pop them in sort of 3 or 4 times a day just to keep the eyes sort of nice and moist. There are hundreds of eye drops on the market, and it can be very difficult for people to decide which one that they're going to go for. But as a general rule of thumb, you can pick one, and if it's too thin, go for a slightly thicker one. If it's too thick, you can go for a slightly thinner one. I like to think about it as is, if you've got, say, a size 5 shoe, you might be a size 5. One brand works really well, but then another shoe, same size, doesn't work quite so well. But the important thing with dry eye drops is that you go for preservative-free. And then other things that you can do are warm compresses. So nice warm flannel in the bath or shower, as warm as you can manage. Just hold it over your eyes for about a minute and then just gently massage the lids.
Perfect. And Ros, the treatment that I've used includes the masks, the mask that you put in a microwave to heat up, and then you apply that on your lids for a few minutes, and that liquefies the oil that might be trapped in the glands within the eyelids. And I've seen pictures of these glands that get blocked up, and then you lose that oil which protects the tear film, leading to dry eye syndrome. And actually, it's a very simple and safe treatment, isn't it?
It absolutely is, and it really doesn't take very long. And if you think about that oil, it kind of like it oozes out of the glands and it collects around the lid, and it almost behaves a bit like plaques, and bacteria starts living in that as well, and that starts to cause irritation. So it's really important to kind of get those oils flowing and that area cleared. And generally, if you want to use one of those heat bags, they can go in the microwave. They can actually go in the oven as well, some of them. So that's great. And you want to try and make sure it's kind of like, it's got a slightly antibacterial surface to it as well. That's what I always tell my patients, to really keep that area clean. So we're talking about hygiene as well as, getting those oils flowing, so to speak. And that makes such a big difference. I mean, a lot of patients come and go, oh, that's so simple, but it was so good. And it really sustains the heat well.
Yeah, I think we forget that we live in air-conditioned atmospheres and environments, central heating. It's drying everything out all the time, and certain occupations as well. Now, tell me about screen time, because we're all using devices, and yet we blink so many times less when we're looking at a screen, don't we, which doesn't help things.
No, absolutely. So it's really interesting to remember, because everybody talks about this blink, but what does blink actually mean? We're talking about those oils that live, the glands that live in the lids, and they live like little piano keys. So they're sort of like, if you look at the inside of the lid, there's little piano keys. They're very straight. And as you blink, it's a bit like a windscreen wiper going over the surface of a windscreen. So you blink and this oil comes out and you smear it over the front surface, and it really kind of like creates this film that stops the lower layers evaporating away. But if you're not blinking enough, and every time you do a concentrated task, you don't blink, your blink rate drops. It's how you're hardwired, it's your chemical responses. So you don't blink, and then those oils don't come out, and then the lower layers evaporate away. And that's when you start getting irritation and problems, etc., that comes along. So your blink rate's really important. And everyone says, well, I'll just try and blink. And it's like, well, you can't, because you're hardwired not to. So when you're looking at a screen, you're looking at a handheld device, or you're looking at a book, or you're concentrating when you're driving, anything like that, your blink rate just slows down, and those oils aren't released.
Thank you. There's something called the 20-20-20 rule, isn't there? Tell me about that again.
Yeah, so this is really important when you're using screens, either your laptop or your phone. And it's to encourage people to take regular breaks. So what we say is 20 minutes of screen time. Take a break by looking at something at least 20 meters away for 20 seconds. So it's not that big a time. We're not asking you to take half an hour break. It's just those little breaks every now and then, and that just can keep the focus changing and keep your eyes feeling more comfortable. And I think now you can even put little timers on your computer, which can just ping just to remind you when the 20 minutes is up.
And of course, once you've used something like a heated iPad, you can express some of that oil using a cotton bud carefully. Yes. And tell me how you would do that.
So once you've essentially what you're doing is melting the oils a little bit, so they're a little bit easier. You can just use a cotton bud just to massage upwards, and then hopefully that oil can come out a little bit more. Or your optometrist can do it as well when you go for your eye test. Yeah,
really important. And so that screen time is something that we need to be aware of. I mean, we're all using screens, usually in air-conditioned, or heated environments, and this doesn't help the eyes at all. But looking after our eyes is important. I mean, we look after our joints. We go to the gym. We know that we should be careful what we eat. But actually, do you think, Ros, a lot of people do ignore their eye health?
Oh yeah, I mean, I think it's a natural thing to do so, because you judge it by your symptoms. So you judge it by things like, well, I can see, so it's fine, or I can read, and it is okay. So it's just one of those things that you tend to tick off. But actually, if we go back to the point that it's those silent conditions like dry eye disease, like glaucoma, like macular degeneration, we're going to see the signs before the symptoms really start to impact you, as a patient on a much bigger level. So therefore, you want to get in there as soon as you can from a clinician's point of view and really affect the trajectory of that disease.
I once had a treatment which actually milked the glands. I think it was called LipiFlow, and you'll be familiar with this yourself. But basically, put a clamp on your lids, heat up your oil-producing glands, the meibomian glands, and again, that liquefies the oil and it's milked out. And it was quite effective, but luckily I don't have to do that anymore. Is that something you use or recommend?
It's not something I've come across myself, but I heard of very similar things. But I think the most important thing when it comes to dry eye disease is that you do get it looked at, because it might be that your glands are blocked. It might be other reasons, which is what's causing it. So being able to really establish what it is can make the difference between which treatment works best for you.
Can there be any serious implications of dry eye disease?
I think one of the most serious things that people can get is quite a lot of discomfort, and you can have if it's very dry, you can cause problems with the front surface of the eye called the cornea. And again, that's really not something that you want to do. So again, making sure that if you're getting the symptoms of grittiness, or you're feeling you need to blink a lot more, or even sort of slight sore, you go and have it looked at and checked out.
Yeah. And Ros, I guess there's a front of eye specialist. You see quite a lot of corneal issues that might be related or contributed to by dry eye disease.
Absolutely. So, even people that are wearing contact lenses, for example, their infection rates go up, conjunctivitis, things like that. And actually, we were just talking about lipid flow. There's lots of other treatments as well that we can that we do in practice now. So they're in practice treatments. And it just is, if you think about it a bit like the hygienist, when you go into the hygienist, you just have your teeth cleaned, etc., and it really maintains that gum health and that. So in the same way, there's treatments that we can do that will just maintain that lid health. So, there's things like Blefex and new lids, Zest treatments, which actually is just about debriding and removing that kind of lipidy, fatty stuff that collects around the lashes and lids. And, the eyes are just generally a lot more comfortable. So it really helps maintain that heat bag regime that we were just talking about. So it's a bit like you brush your teeth, that's the heat bag, and come in and see me and we'll do a bit of a clean, and that's the hygienist bit. So, and it really helps maintain lid health and lid hygiene.
Well, that's really important. As I say, it's one of the commonest things. So that's just the very superficial part of the eye. You're seeing all layers of the eye. Let's go back to the very basics. How often should people have eye checks, and when should they start? At what age?
So most adults should have an eye test sort of around every 2 years, but your optometrist will tell you if you need to be seen more. Sometimes people need to be seen every year. For children, we absolutely recommend that even from when they're babies. If you are concerned about your child's eyes, you should take them in to have a look, be checked. But certainly, if you haven't really had any particular issues with your child, or there's no particular family history, and what I mean by that, if there's no one in the family with a squint or very high prescription, then around 3 is a good age, certainly, for them to go in and have.
Okay, and when you're doing checks, say on a person you haven't seen before, what are the things that excite you most when you find something? Because like doctors, we're quite pleased when we found something we can treat. What are you looking for, and what do you get excited about when you find something that's treatable?
Well, I think what the most common actually eye problem is refractive error. So that's that they need glasses. So actually when somebody comes in and says, I'm really struggling with my vision, I just can't read, and you give them a really simple things, give them a pair of glasses, and suddenly they can see, and you've kind of reopened their world. That can be really satisfying, I suppose, as a clinician. We never like to detect eye disease in patients. We obviously don't want anything. My special interest is in macular degeneration. So I guess when I see somebody with a macular problem that I can help them, then that can be really satisfying as well.
Okay. Let's describe what a macula is. Can we use these terms? The macula is which part of the eye?
So at the back of the eye, you have a photosensitive layer called the retina. And the macula is just that central part. And right in the centre, you've got a little small area called the fovea, and that's where you see all your coloured and detailed vision. Yeah,
absolutely. And that can degenerate with age and with other conditions, which we'll talk about in a moment. But let's go to the front of the eye again a little bit. What about cataracts? That's the lens. Yeah. The lens becomes stiffer and firmer and can't, it's less elastic, so it can't focus on near objects as we get to 40 and a bit beyond. That's the typical age, isn't it? And presumably you see cataracts as well.
Cataracts is really common. I mean, most people over the age of about 50 have some degree of cataract. That doesn't necessarily mean it affects your vision at all. It just means we're seeing some very early lens changes where it becomes a little bit more cloudy. As cataract progresses, and it can progress very slowly, if it gets to a point where it's affecting your vision, then we can sort of refer you for surgery for that. Yeah.
And cataract surgery, Ros, has come on in leaps and bounds, hasn't it? I mean, it's almost like a routine procedure now, which is done relatively quickly and with fantastic results.
Absolutely. We are seeing people kind of like go in and literally have a cataract done, and then they're back at their desk like within half a day, you know. So it's absolutely it's brilliant what we can do. And again, what we are finding, and I was just reading a little paper just a little while ago about this, that you should have a look at the front surface before you do the cataract surgery. If you clean that up, then actually the results from the cataract surgery is a lot better. So that's what we're starting to look at now in a lot more detail, especially in the practice that I work in.
And I think you're exactly right, Ros. When you're considering a patient with cataract surgery, you're looking at the whole eye. You can just take the cataract out, that's one thing, but you want to check the front of your eye, check the back of the eye just to make sure that there's nothing else going on, because quite often, well, not quite often, but it can happen where people think, oh, they can't see because of the cataract, but actually it's a problem at the back, and taking the cataract out may or may not cause and make it better.
And one of the most interesting and exciting periods in my medical training was assisting a surgeon, an eye surgeon, who was putting in artificial lenses, which are splintered across the iris. And it's such a sophisticated technique now. And elderly people who are struggling to read or watch TV or look at the faces of their grandchildren suddenly say, I can see perfectly again. And it is such a wonderful procedure in that respect, isn't it?
Yeah, well, we're talking about quality of life, aren't we, really? The quality of life is enhanced, and especially if you've got somebody that's older that maybe isn't moving around so much. This is a big part of their life, being able to see people, see things, read, watch the TV in a lot more detail. It makes a lot of difference. It really, really does.
Cataracts can arise from a number of reasons. Trauma in some people, but sun damage, oxidative stress. What can we do to prevent the development of cataracts?
I think if we're kind of like looking at sun damage, that's a really obvious one, isn't it, really? So it's just things like protecting your eyes from the sun is really important. And everybody just, sunglasses and a hat, definitely. But let's think about the fact that we need light to see, but actually light is what does the harm as well. So we need to have spectacles that have, or sunglasses that have ultraviolet filters in them, polarizing filters to make life so much more comfortable. So that reflection that comes off the surface of water, for example, is cut out by a polarizing filter. Things like that would just make the eyes, a little bit more comfortable, but means there's less damage to the inside of the eye as well.
Yeah. Okay. Now, we've talked about macular degeneration. There are two types, both of which affect the elderly more than any other age group. Tell me about the two types and their treatment.
So macular degeneration, like you say, you have the dry form, so dry macular degeneration, and the wet form, wet macular degeneration. So the dry form, what's happening is it's just sort of general wear and tear of the cells in the retina at the back of the eye. As the cells, as you get older and they don't kind of work quite as well, it leads to deposits called drusen, and these little drusen can be dotted around the back of the eye. And a lot of people can have drusen and they don't notice any issues at all, while some people, if it gets very bad, it can really affect how well they see. They'll never go completely blind. It affects the central part of the vision, so they'll always have the peripheral part, but it can really affect how they live. The wet form occurs when abnormal blood vessels grow from underneath the retina, and then they leak. And that's when you get the quite catastrophic vision loss. I mean, people can go to bed seeing okay, and then the next day they come and say, I just can't see anything at all.
If you were to see a patient in your clinic and you identified macular degeneration, what would you advise the patient to do?
So if it's wet macular degeneration, that is an urgent referral straight to the hospital, because they'll ideally need some form of treatment, and that is in the form at the moment of eye injections. If they have the dry form, unfortunately on the NHS there isn't any treatment available for dry macular degeneration at the moment. There's a few things sort of coming in the future, but the research studies aren't quite there yet for us to fully adopt them, but they look quite promising for the future. But I guess the things that we advise patients when we notice macular degeneration, first of all, is if they're smokers, stop smoking. That's probably the biggest thing that they can do. Also, having a really healthy diet, that's really important. And keeping a healthy body weight, just the sorts of things that we'll be looking at if you're wanting to keep healthy yourself. And if they can, just keep their blood pressure and all their cardiovascular issues under control. And you can see your GP about that. They can help you with that. But also, you can take some supplements. Now, I say there's a little bit of caution. There are two big studies out which talk about supplements, and that's the AREDS 1 and the AREDS 2. And that has been shown that it can stop the progression of dry AMD into wet by up to 25%. But when you sort of really dig deep into the data, we're not quite sure how that data translates out to the general public, because the people that it had the most effect on were the people who had really, really poor diets. So if your diet is pretty good, the effects of the supplements will be slightly less, but it doesn't mean that they won't do something. But what's also important when you're looking for supplements is that it is the AREDS2 formulation. That's really important. There are a lot of supplements out there which say they're based on it or they're loosely around it, but they didn't do the research on anything else apart from the AREDS2, so we can't for sure say that anything else works apart from the AREDS2 formulation.
And I know there's a lot of work being done. I went to a lecture by a professor who was talking about the different types of these supplements, and it is important to use the ones that have been studied and trialled that do show a benefit. And the evidence shows that actually not only might they help with prevention of macular degeneration and the health of the macula, the bit of the eye that the retina that focuses on detailed vision, but it might also help with brain health as well, because the supplements are very closely linked. The optic nerve, the macula and the brain are closely related, and these supplements could benefit people if they take them from an early age, could prevent the problems down the line many years later. And of course, they're completely safe. So watch this space, I think, for further research on that.
And I think that's a really good point you make. I think patients are often, especially macular degeneration patients, I have to say, are really keen to find out all the new things that are available for them. And it's really important that patients are empowered about what's out there, because there's so many new things, and some of them are research-based, some of them aren't. So it's a really good idea for them to look at reputable sources such as the Macular Society, the RNIB. We've got a website ourselves, which is lookafteryoureyes.org, so that they can look at what's out there, what's research, what's evidence-based, and which ones they can go for.
Yeah. And of course, some of these substances have been depleted from our diet because of the soil depletion, and we're not getting enough of them compared to the amounts that we would get from our diet even sort of 50 years ago. Wow. So important. So we haven't talked about glaucoma much. Do you see a lot of glaucoma?
Yeah, glaucoma is fairly common. What glaucoma is that it's the pressure in the eye that's just too high for your in your case, and it causes damage to the optic nerve at the back. Now, so we talked a little bit about it before. It is very unlikely that a person's going to realise they have glaucoma in the early stages. It is only when they've had quite a lot of significant sight loss which they will be able to come and say, oh, I've got a little bit of tunnel vision. So this is why it's so important you see your optometrist regularly, because they will check for any small changes. And if we can treat it early, then hopefully we can prevent avoidable sight loss.
Perfect. Ros, I want to come back to you and talk about the front of the eye again, because this is such a common thing. Demodex. Not many people know the word, but it's an interesting story, isn't it? Tell me about Demodex.
It certainly is. Demodex, a nice little person, or a nice little microbe that actually lives on the surface of the skin, and it's supposed, like everybody on this call has got Demodex, and they're supposed to be there. They are really an important part of the flora and fauna of the bacteria that live on our skin. And a little bit like the great white shark, I like to call it. They kind of like move around and do a really good job. But it's when they get out of hand and they kind of like their population becomes too big, they start causing some irritation and problems. And they're there causing problems more often than not. So everybody gets a bit scared when you talk about it. There's lots of papers, there's lots of reports out there, and we hear about it a lot more just in the general population. So they get scared and they want to eradicate them completely, but we don't really want to do that. We just want to keep it all under control and let them do their good job and not cause too many problems.
Do they contribute to blepharitis and dry eye syndrome?
They absolutely do. Blepharitis is a lot of times associated with Demodex, and especially if you've got skin like rosacea, things like that, you're more predisposed to having that overpopulation of Demodex that causes the irritation and the redness and the slight increase in infections, those kind of things.
Okay. And what's new in the world of contact lenses?
Oh gosh, that's always an evolving arena. I think the most interesting thing from my point of view is we have something called myopia control. So we are noticing that when you use a lot of handheld devices, children especially are on their phones and are on their devices a lot more. There seems to be an environmental influence on increasing their myopia, so increasing them going from -1 to -2 a lot more rapidly than they naturally would have done, say, 20 years ago when they weren't using these devices as much. So now we have contact lenses that they're a bit like braces for teeth. They kind of hold back that myopia a bit. And that's the biggest area of interest, because when somebody becomes more myopic, I'm sure Denise will back me up on this, is the probability of them having problems with their eye health increases significantly. So if we can hold back that myopia, or a bit like the braces, kind of an analogy, then we're more likely to manage that disease progression a lot better as well, or the incidence of it at least.
And of course, the choice of lenses now is phenomenal, isn't it? So there's something comfortable for everybody.
Exactly. And that's where your contact lens optician or your optometrist will be able to guide you and help you and take you in the right direction with that as well, and help you choose what's right for you.
Mm-hmm. Absolutely. And let's just talk briefly about laser treatment, eye laser treatment. When would you recommend people think about that as opposed to contact lenses?
I think so. I've actually had it myself.
Me too.
Yeah. And I had it because I was very short-sighted, and it made a big difference to me. I think not everybody is suitable for it. So and we all go back to this. Firstly, you have to make sure that your eye health is optimal and that you don't have any other problems, because if you have anything else, particularly with the front of the eye, then laser treatment's not going to be suitable for you. I found it very helpful for me. I think what I would recommend to anybody would be, first of all, go and have a chat with your optometrist first and see what they say. And then they can discuss the pros and cons of it and decide if you're suitable.
Absolutely. Well, I had a laser blended vision, where they laser one eye for reading and they leave the dominant eye for distance. Yeah. It's not frequently done, but I was very reassured when I went to the clinic where I went. The testing of my eyes took hours, many hours, to make sure I was a suitable candidate. And you're left with two different fields of vision in each eye, and your brain learns to accommodate the two depths of field so that you can use your one eye for reading and the other eye for distance. And I've been able to throw away my reading glasses.
That's brilliant. I mean,
which was nice.
It's not as good as perfect vision with normal eyes,
No.
but it certainly does work really well. And you can mimic that in contact lenses as well if people.
Yes. It's not available, unfortunately, on the NHS, so not for most people
Sounds very
anyway.
liberating, actually. Very
liberating. I was very reassured when I went to the clinic, because there were lots of top sportsmen walking around, and I thought, well, if they're going to risk their vision, well, of course they weren't risking it at all. It's good enough for me. So that was an eye opener, if you'll excuse the pun. So we've talked about all sorts of eye conditions, and it just reinforces the point, doesn't it, that we need to be careful about our eyes. We need to have regular checks and not take our eye health for granted. And I think the two of you have helped us to determine that and given us some ideas about how we can look after our eye health. So thank you both very much indeed. Well, my thanks to Denise Voon from the College of Optometrists and Ros Musa, an eye health expert. And don't forget, for more information on anything you've heard, go to our show notes at drhillaryjones.com.
The Dr. Hilary Show, brought to you by HealthSpan, bringing you quality vitamins and supplements since 1996.
I'm back with another question for Dr. Hilary. So we had Ros on the show earlier talking about our eye health. How important is it?
It's really important. People will think, eye health, what can we do for that? Their eyes look after themselves, don't they? But they don't necessarily. The commonest eye condition of all is dry eye syndrome. And people get these dry, sore, itchy, irritable eyes and wonder why. Air conditioning, central heating, all of that sort of thing. So the important thing is that we can do something about that. So Body Doctor, for example, has a policy of heat, cleanse, revive. And it's something you can do easily, either when your day starts in the morning or in the evening when you're taking your makeup off or you're getting ready for bed, washing your face and brushing your teeth. A little bit of care for the eyes can make a huge difference.
But the skin around our eyes is quite sensitive, isn't it? We've got to be careful if we're, doing eye routines.
Absolutely. The skin around the eyes is very delicate, the eyes themselves too. So it's important to use sterile products that are in date, that haven't been contaminated, that are preservative-free and gentle. And if we follow those simple guidelines and follow the instructions, then we can't go far wrong.
And where can we go for information about that?
I think the best place to go would be bodydoctor.com. They've got a great website, all the information you need.
Thanks again, Hilary.
My celebrity guest this week is someone who's been a constant on our television screens for years, charming audiences with her warmth and versatility. From her early start on BBC Northern Ireland to becoming a staple in British broadcasting, she's done it all, from co-hosting The One Show to brightening our mornings on Lorraine. I caught up with Christine Lampard during another busy day, balancing work and family life. Hi, Christine. It's lovely to be interviewing you for a change. The other way around, I get my own back.
This is a real treat. Look, the Dr. Hilary show. Oh my goodness, I've finally made it.
The doctor will see you now, right?
Always.
It's the only way you can get to see a doctor these days is on telly or on podcasts, right? Okay. So my first question is how are you? How is your health?
Hopefully, touch wood, Hilary. I think I'm doing okay. Just the usual stresses and strains, and 2 young children, husband, dog, family, all the usual things that everyone else has to deal with at home. But no, I think I'm generally okay, Hilary. I'm active. I eat well. I do everything in moderation, really. Don't get me wrong. I'm not hardcore about anything, but I think I do what I need to do to sort of keep as good as I can do. When you do have a busy life, you have to sometimes take the time to, whether it's just an afternoon of doing nothing. I do know when I get to that limit, okay, today's my day to do nothing.
Yeah.
So I'm slightly aware of where I'm at in terms of my health, but I think generally I'm active and I eat well. And what more can you do, really, unless you go to some other intense level. But for most of us, we don't have the time for that.
No, that's really important. I mean, you're obviously juggling lots of different things, and the children are growing up. You've got those pressures. You've got lots of work. You're very busy. But work-life balance is really important, isn't it?
It is. And weirdly, before having children, and I was 39 when I had my little girl. So I've had, I was the geriatric mother, as they say, on the hospital ward. But, that's what worked for us at the time. That was the right timing for us. I was lucky enough to have lived an incredible life up until that point, work-wise and everything else. And when I had the children, I didn't want to have to be working every single day. I was quite happy to pull back a little bit, and luckily I was in a position to do that. But strangely enough, like going on Lorraine with you, that comes in little bursts of time, and then it's downtime again at the end of that, because I did want to be able to take them to school and pick them up and kind of be a mummy, to be honest. So I try to get the balance as best I can. And I think for me, I love being at home and cooking them dinner and getting them to bed. And that's a privilege to it, because I know a lot of people want to and they can't. So I do my best to have that balance kind of okay. And actually doing what we do as well, Hilary, as there's a lot of work in the evening, say the night before doing a Lorraine programme, and because I'm a geek and I have to read everything and I have to watch everything. But equally so, I can be home by 11:30 in the morning, albeit you have an early start, but I can still be home and have the rest of the day. So I do try my best to always think, okay, what works at home, and then I'll work around that almost. So I'm in that position in my life now, thankfully.
Funnily enough, I'd never describe you as a geek somehow. I hadn't
really
got you down as a geek at all. How old?
I am. I'm a geek in lots of aspects, Hilary.
How old are the children now?
So my little girl is 5. She'll be 6 in September. And our little boy, exactly, he's 3. So, just full on active, happy little youngsters that, it's mommy, daddy all day long at the minute in the summer holidays. But it's brilliant.
And of course, you're married to a footballing legend who's obviously busy. He's all around the country and probably international as well. So that work-life balance must be a challenge sometimes.
It can be. you know, weirdly, we feel very blessed, which sounds like a real interesting to say, because he's not working at the minute. But this is the first time that that's been the case. Because when he was playing, certainly he was, you know, it was, you're all in. That's what your life is. It's training every day. You know, there's no Christmases and New Year's and all of that. If you're playing, you're playing. That's fine. That's what life was. And then when you go into management, you could literally be anywhere doing that job. So we have had time. He's been up in Derby, he's been in up Manchester and Liverpool, and so we've done our fair share of sort of moving around. And so particularly when the children were really young, he wasn't here at all. So we've really appreciated the past sort of almost year where he has been at home, and the children have loved having him here, and it's been a lovely kind of happy household without having to get in a car and drive for 4 hours, whatever. But again, if that happens, that's what you do. And so we never moan about that. But I appreciate the times when he's at home too, very much.
I bet. I said people see the glamour, but they don't always see the reality of what's involved.
No, they don't see me packing a car up with scooters and prams and nappies and all that kind of stuff. No, there's no glamour in that bit.
Have you ever had any medical issues of a serious note yourself?
Gosh, I luckily not.
Good.
Hillary, I have been fairly lucky to get to the stage without, I guess, maybe having something sort of serious. But weirdly, you say that, and I think I suffer from health anxiety because I worry about everything. I worry firstly about the children. Like I'm terrible. Like a little bit of a temperature, like my mind goes to terrible places really quickly, and I was never like that with myself until having children, and now I worry about myself because I have children, because I want to be here for them. So I definitely am a bit of a worrier when it comes to health. I think that inside my mind there's something's clicked in recent years. So I wouldn't say I'm completely settled and content, because I'm sort of always thinking, but what if? But generally, I have been very good, and even my 2 pregnancies, I was so lucky. And like I say, I was an older mum to be, and I loved both of my pregnancies from start to finish. I felt really good, and my hair was thick, and my nails were growing, and everything seemed to be in really good shape. And then it goes downhill after. But during the 9 months, I was really lucky because I had 2 wonderful pregnancies, actually. So thankfully I didn't suffer too much during that, because I've had so many friends that it was a debilitating 9 months for them. And so even that I got through. But I do try to, and I think you'll hopefully back me on this, I am a kind of a happy, sort of go lucky person. I like being positive. I try to just get on with things in the happiest sort of way, and hopefully that helps your overall health, weirdly. You know, I do try to be upbeat as best I can, but definitely if they have a temperature, I'm like, oh my God, I have to call Hillary.
I was going to say, do you know any doctors you can call up at the drop of a hat?
Well, you know, I'm very lucky. I've got you on speed dial, so I'm fine.
I think it's very common as a maternal instinct to worry about your children. Of course it is, you know, and I understand that. Now, in the past, I know that you've always been quite fit and healthy yourself. And tell me about this amazing water ski challenge you did for Sports Relief.
Oh, I get flashbacks of fear and pain when anyone asks me that still after all these years, Hillary. But it was for Sport Relief. And I had gone to Uganda with Sport Relief to film a couple of these pieces that you see on the show on the night about, you know, what the charities do for various people over there and how it helps so many people. And when I came back, I thought, I want to be one of those people. I want to do something. I want to try and raise money. And so anyway, someone suggested, what about water skiing? And I had never water skied. I can't really swim, to be honest. I can, you know, do a kind of doggy paddle, but that's it. I'm not, you know, going to fix anytime soon. But I sort of foolishly and ignorantly thought, oh, water skiing looks okay. You know, once you're up, you kind of float. It obviously isn't that. And so we did, in the end, after about 6 months of hardcore training in the winter, in the rain and the cold and the ice, I got the wetsuit on, and it was 24 miles of the English Channel. At some points as well, I couldn't even see the boat in front of me because of the swell. It was just petrifying. I fell about 5 or 6 times, and they said if you fall any more than 3 or 4, will not the energy to finish it because it was so intense trying to get back up in the waves. But we did it, and I still cannot believe it to this day. But I've got strange muscles that pop out of my arms still from the training. And I put on about 2 stone in weight when I was training for it. It was just hard muscle. And I needed it to get across. I mean, sadly, my bum doesn't look the way it did right then, but I was in fairly good nick just from training so hard. But we raised like 1.5 million, I think it was, in the end. So it was all completely worth it. But the sense of responsibility when you were doing it, you think, oh my gosh, I'll be the first one that does a challenge and can't complete it. How devastating will this be? But we managed to do it, and it was an extraordinary moment in my history, that's for sure, because I'm not a big physical sporty person. So yeah, it was something else. I get to show off still on holiday occasionally.
Well,
And go,
absolutely.
yeah, I can water ski.
That's an extraordinary achievement. It's absolutely
mad.
brilliant. I once harboured an ambition to windsurf the channel. I never got round to it in the end. But
Well, Hilary, if I can water ski, you can do that. Trust me, anyone can do anything if I did that.
and how do you keep fit now? What do you go to the gym? Do you run? What do you do?
I'm very active. I rarely sit down, is the truth, Hilary, whether it's just in the house with the children, sort of cleaning, the usual stuff around the house. But we've got our dog. On days when I'm off, we'll go for walks with the dog. There's always some sort of a walk involved. And I do enjoy the gym, but I've got a friend actually who happens to also be a personal trainer. And when I see her, she's fantastic. And I like doing the weight resistance type stuff now. And I think as you get older, I know you've said it before, that's so beneficial to your health. And I kind of like doing a lot of weights as opposed to kind of being out running for an hour. That's not quite my thing, but I do enjoy that. And I've just started Pilates, as in the reformer. Now, when I say just start, I've literally done 1 class. I've never done it before. So I'm going for my 2nd class this week. So I'm trying to kind of branch out a little bit in the fitness world. But I think being active generally is really good. There's not much lazing around anymore. And I think that sort of naturally keeps you relatively trim without having to work too hard because you're just on the go all of the time. But I do enjoy it. It's great for the head. I come out feeling energized after I've had a bit of a gym session.
Yeah.
And I know Frank has to go to the gym or he starts to lose his mind. He's been, so indoctrinated that this is what you do every day. So he's still very fitness orientated too.
Yeah. Great for the endorphins, great for the happy hormones. Do you take any
Yes.
supplements?
I take, and this is actually most recently, and I'm a terrible one for remembering, and no matter where I put them in the house, I forgot to take that. I'll do it tomorrow. So, but I do have my omega of fish oils. I like taking those. I actually started taking, I don't know what you think about this, turmeric.
Yep.
Don't know what you think about that.
Yeah.
What else am I taking at the minute? And sort of like a general all over kind of just multivitamin type one. But I have to say, it's something I've become more and more interested in. I would like to sit with someone like yourself and say, this is what would suit you.
Yeah.
Because I do think there's huge benefits. And I was always low in iron, weirdly, when I was pregnant, particularly. And I had to take a lot of that. It was ferrous sulfate. I had to make sure I was taking my iron every single day. And I'm naturally quite low in iron, actually. So I would try to take my iron too. I can feel when I'm low in iron, I'm a little bit, just feel like I'm not quite in the room is the best way I can describe it.
Sure.
And when I start taking my iron again, I can feel it back quite quickly. So that's what I would take. But I would love a proper doctor to tell me. So you need to have your bloods taken and everything else, I guess. But I think there's huge benefits in knowing what you're lacking.
Sure.
And,
Yeah.
if you take a supplement and that fixes it, it's an easy fix in the end.
Absolutely. Well, you mentioned turmeric, and it's gaining a reputation for being quite good for joint health and anti-cancer as well. So that's interesting. Vitamin D, of course, coming from Northern Ireland, you don't get much sunshine over there. So especially in the winter, a bit of vitamin D supplementation is not a bad idea. So finally, your recipe then for good health, mental and physical health, what would be your top tip for our listeners?
I have to say, for me, just trying to find happiness in the little things, Hilary, from a mental perspective at least. I love nothing more at the weekend, going for a walk, maybe going out for a lunch in a pub somewhere. It's little things make me so happy. Having my bathrooms cleaned and the floors hoovered. It sounds ridiculous, but I feel like I can like just face the world head on when I've sort of had my list of jobs ticked off. And I kind of, that's a massive part of me feeling mentally good. And then on top of that, it is having good relationships. And, I'm very lucky that my husband and I have a great relationship, and my family and friends. And so there's happiness around you. I think, when there's one element of your life that's creating any kind of angst, it can overtake everything else. And so I like to try and sort things. So if something's not good, I try to sort it, because it's like death by a million paper cuts if you let things continue. So I just think it's trying to sort things where you're not having to go to bed at night worrying about something. So I think that general happiness is a big, big part of my overall health. And enjoying what you do, if you're lucky enough to do that. Again, I love going in, spending time with you and with all of the team. That makes me happy in my mornings. And it's all the little things that sort of come together to create a happy person for me. And you can start small by doing that. Do your list, tick them off. There's happiness comes from that, and that definitely, for me anyway, it sounds so simple.
I think it's
boring.
really, that's my take-home message today. Happiness. I wish I could prescribe it on the NHS.
Absolutely.
Christine, I was recently in the Caribbean, and when you ask people there how they're feeling, they don't just say fine, they say, I'm grateful. And I just love that.
Yes.
I'm grateful. So gratitude, happiness, that's our prescription today. Thank you so much for being candid about your health.
All.
You look brilliant. You look so healthy. It's always a pleasure talking to you and working with you, and I look forward to seeing you next time.
Hilary, thank you. What an absolute delight. Thank you so much.
Well, that's it for episode 5 of the Dr. Hilary Show. We'll be back next week, so be sure to listen to your programme on your favourite podcast platform. You can also subscribe to our YouTube channel, The Dr. Hilary Show, and for more information, head to drhilaryjones.com.
The Dr. Hilary Show, brought to you by HealthSpan, bringing you quality vitamins and supplements since 1996.